This is Dr. Daniel Paull, orthopedic doc with Easy Orthopedics, and today I'm going to talk about what to do when your knee swells up like a balloon. If you like this video, we put out new content weekly, so please like and subscribe. So the first thing when your knee swells up is to figure out why it swelled up, right? Were you doing nothing and all of a sudden it just started, or did you really bang it hard and now it's swollen up like a balloon? Did you take a funny step a certain way and now it's swollen up? That's the first thing you've got to figure. If you banged it or hit it really hard on something and it swelled up like a balloon, I highly recommend you get x-rays. Especially if you can't walk on it. If you can't walk on it, you certainly need x-rays. But that will just tell us, just to make sure you didn't like break your kneecap or break your tibia or your femur or anything in the knee joint. You want to make sure you didn't break it and you're walking around on a knee break. Again, it's uncommon to walk around on a knee break, but I've seen it before with really small tibial plateau fractures, which is the top part of the shin bone, or sometimes with patellar fractures. So that's the reason you can have swelling, and then that's the reason you're going to get the x-ray. But what if you were doing nothing and just kind of sitting around? Sometimes that can be because of an inflammatory condition like gout or rheumatoid arthritis. If that's the case, it makes sense to kind of get your knee drained and send the fluid off if you're able to see a doctor, and they can tell you what is causing that. Also, if the joint is infected, it's pretty rare if you have a normal knee joint, not like a replaced knee joint, to get infected. I think I've only seen it happen in diabetics, but that's like excruciating pain that you can't even really move it and it's red and swollen. If that's the case, getting fluid sent out to the lab will tell you whether it's gout, whether it's infected, or anything else. If it's kind of none of those, and maybe you tweaked it a little bit and it's swollen and you can walk on it, but it's a little bit uncomfortable, then you can kind of see how things go. You can kind of ice it, elevate it, wrap it, and what you probably had is a cartilage injury, and whenever the cartilage gets injured, it dumps a ton of fluid, and the fluid gets stuck in the joint capsule, so that's when it swells up like a balloon. So in that case, you're okay sort of watching it for a bit. Again, no trauma, and it's not like it just blew up for no reason, and it's not like red and hot. Then, eventually the body will resorb that. So I hope I was able to answer your questions about what you should do if your knee swells up like a balloon. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any medical advice because this video and all my videos are for educational purposes only. Thanks for watching.